What does ADHD treatment for teens look like? Hi, my name is Catherine, and I'm a therapist with Mindful Healing. I also specialize in ADHD treatment. When it comes to treating ADHD, a lot of people aren't sure what to expect or what it might look like. This is almost a trick question because in a lot of ways it looks very similar to most forms of therapy. It means addressing specific issues that come up for that person because everybody who's dealing with ADHD is dealing with a different version of ADHD. All of our brains are different, even if we're all struggling with a similar thing. However, the main difference between ADHD treatment and other forms of treatment is a focus on using skills that are going to be able to be applied at home and in school that are specifically tailored to the ADHD brain. Not everything that works for someone who doesn't have ADHD is going to work for someone who does have ADHD. In fact, usually it doesn't. And this is true vice versa. Not every skill and piece of advice that we use in ADHD would work for someone who's neurotypical or doesn't have ADHD at all. So the major difference is that we look for the specific traits and experiences that you have as someone with ADHD, what your specific presentation looks like. And then we tailor skills specifically meant to address whatever you're struggling with. This means looking for ways to develop our skills around organization, develop things around timekeeping, sleep hygiene. Sometimes it means practicing paying attention to things. Sometimes it means embracing the chaos. It depends on what we're dealing with and who we're dealing with. So what ADHD treatment looks like really depends on you. If you have questions about ADHD treatment or would like to explore your options, please feel free to reach out to Mindful Healing.